In this video, we're going to be covering some self-myofascial release. Essentially, that just means self-massaging using a foam roller, lacrosse ball, or any other sort of soft or harder implement that we can use to just roll across our tissues. This is something that we can use on a daily basis. This is for maintenance work, as well as doing some self-massage work and release work that can help prior to performing your car's work, or pails and rails work, or any other mobility work that you may have been prescribed. This will allow also some blood flow into the area and release some tissue tension and tightness that we might be feeling. This is a very passive method, so it's not going to necessarily result in any long-term useful changes on its own, but that's why it's very important that we combine that with the active mobility work in order to reinforce where we want our joints to be stronger and positions that we want them to be able to access. And that adaptation is always a more active pursuit, which takes a little bit more time. So for this video in particular, we're going to be covering just the lower body portion. So what I'm going to do is I'm going to demonstrate a sequence that you can use. You can use this on a regular basis. Now, when we do our foam rolling, there will be some pain associated with this, or discomfort as well. That's okay in this case. Our goal is to kind of try to relieve that as much as possible. So what we're going to do is we want to focus on just rolling over tissue, avoiding bones. There will be areas that are more tender and feeling more painful to the touch when pressure is applied relative to some other areas. Probably spend a little bit more time on those spots. Minimum, I would suggest, is spending maybe 1 to 2 minutes on an area, and for really troublesome areas, maybe upwards of 5 minutes or so. Alright, so we're going to get started, starting with the calf muscle here. So what we want to do is we're going to position a roller, and you can see my roller is one that has some of these bumps and stuff. If you don't need anything like this, feel free to use even something as simple as a PVC pipe, something softer to start. Medicine ball or something like that as well can work. Whatever implement you choose, just make sure that you can tolerate it. If it's too painful, you might need something softer to start with. So for the first side here, what we're going to be doing is just rolling across the muscles underneath the calves and above the heel. And what we want to do is, again, just kind of find some areas that might feel really tender, maybe a little bit of pain. And once we find those spots, so for example, I found one here, what I want to do is I'm just going to take a deep breath in and exhale. And try to think about melting into that roller, applying a bit more pressure into those spots. And for the sake of the video, I'm not going to hold them all for minimum 2 minutes. I'm going to just sort of show you that sequence and how you can kind of go across as you do this on your own. So we'll start off with the calves there, and then we want to eventually move up to the bellies of the calves, spending some time there. You can also then rotate and go into the outer areas of the calves here, and then also do the same into the inner. Then eventually we're going to move on to the hamstrings. For the hamstrings, I would suggest, obviously don't go right directly underneath the knee. You're going to start slightly above. Now you can use your hands to prop yourself up, and then use them to kind of roll yourself back and forth. Again, looking for any areas of that tissue that feel really tender. Once you've gone through your hamstrings, you're going to switch it over to the front of the quad. For the quad, what you're going to be doing, starting above that knee, you're going to place that roller out to the side. The other side of your body is just going to be hanging off. Bring that knee to flexion there on the opposite side. Arms here, elbows underneath the shoulders. And then you can just start to pull yourself across, finding those spots where you feel a lot more tender relative to some other areas. Just try to breathe and relax into those spots. And you can work up the quad. eventually coming up towards the top of the hip. Once you've gone through those areas, next area is going to be the side of the leg. So what we want to do here, position yourself so we can start right below that hip, almost in a side plank-like position with that elbow underneath that shoulder. The leg we're rolling, that's going to be underneath, completely rotated in that direction. The opposite leg can come cross over, and we can use that leg as well as the elbows and arms here to help push and pull ourselves across the side of the leg. Now what you're looking for are areas that just feel like thick bands. Certain areas, again, might not be as bad. Other areas are a little bit more tender. For example, I found a spot right there, so what I would do is stay here for my minimum 2 minutes. And then eventually you can work further down the leg all the way towards that knee joint. Again, avoid bone. Then we're going to set up that roller. We're going to be now sitting on top of that roller. We're going to get the glutes here. What I want to do is, if I want to roll my right glute, I'm going to have the other leg bent, cross that leg over, apply pressure into my thigh, try to pull that knee towards the floor. I'm going to lean and put my weight onto that glute, onto that hip, and then I'm going to use that leg to pull myself back and forth. If this is not accessible, you can just start off by having that leg out straight. And the same idea, just apply that pressure onto the glute there, side, that tissue there. Once you've completed that area, we can then get into the adductors. So for this one, we position that roller next to us. We're going to then have this side of the body lying on the ground. From here, we're going to bring that knee 90 degrees, place that roller right in between that tissue. Then similar idea, start from the knees, then work your way up the quads, up the leg. You can think of it dividing into 3 regions: lower portion, mid, and then closer towards the groin. Similarly, just find those spots, spend a little bit of time through there, and eventually from here, and then that will be it for the legs. Now, we can get into the lower back and the spine. So what we want to do is we're not going to necessarily put too much pressure directly on the spine here. So what I'm going to do is place that roller underneath my lower back, and then I'm going to twist. I want to rotate my body so that the opposite side is off the roller, and I'm not contacting it directly in the middle. I'm just focusing on the tissue on the side that I want to focus on. And from there, I just want to use my elbows and my legs to just apply that pressure and slowly roll across. And be careful with this. Try to find a good position for your shoulder so that it doesn't feel like it's getting impinged or creating any unnecessary tensions through there. And similarly, just roll back and forth across, getting that tissue there, spending upwards of 2 minutes.